Hello, everyone. We are at 2 o'clock, so we will go on ahead and get started. I am Dr. Tina Lewandowski, the Director of Engagement at the ADRC, and I'd like to thank everyone for attending. Today, we have a presentation from Annette Becker. Annette received her bachelor's in psychology from Truman State University and her master's in counseling and guidance from the University of Missouri, Kansas City. She's worked at the University of Kansas Medical Center since 1996, doing research with older adults. Most recently, she worked in the Alzheimer's Disease Research Center as the Senior Clinical Research Coordinator for the past 9 years, mainly on studies involving Alzheimer's. Just a friendly reminder, everyone, that we need you to keep your microphones on mute. If you have any questions during the presentation, you may type them in the chat, and we will leave plenty of time at the end of the presentation for Annette to answer any questions. Also, we will have the recording available on our website within 24 hours. Annette, we appreciate you taking the time to join us today. So I'm going to go on ahead and turn it over to you. Thank you.
Can you hear us and see us?
Not now. I could. It was a little blurry.
Often.
There we go.
Okay. All right. Hello. We'll get our presentation pulled up and then we'll start.
Perfect. Thank you, Annette.
You're welcome. So it's just this, and then when I want to go to the next thing, I just hit the space bar. Okay, so today I'm going to be talking to you about two different studies that I've been working on. One is called the INFRONT study, and the other is called the VASINEP Signal AD study. And the study we're going to start out with is called the INFRONT study. There we go. Okay, so this is a phase 3 multi-center randomized double-blind placebo-controlled study to evaluate the efficacy and safety of AL001 in individuals at risk for or with frontotemporal dementia due to heterozygous mutations in the progranulin gene. So that's the actual name that the study sponsor gives it. And basically what it means is that it's a phase 3 trial, which means that it's moved past phase 1 and past phase 2. And we're looking at this drug AL001 to see if it's safe and effective to be used in people who have frontotemporal dementia, or what we call FTD. So a little bit about FTD. It is a rare progressive disease that affects behavior, language, cognition, or movement, and it causes difficulty in planning activities, communicating with others, and performing everyday tasks. This disorder is identified by the presenting signs of symptoms, such as behaving inappropriately at work or in social settings, difficulty speaking and understanding language, and problems with movements or daily activities. Now, some individuals have a family history of FTD caused by a gene mutation that affects the proteins essential for normal brain cell functioning and survival. Mutations in the progranulin gene reduce the levels of progranulin in the body. Progranulin is a protein involved in cell survival and regulating inflammation, and normal levels of progranulin are required for the brain to work properly. So the purpose of this phase 3 study is to determine if an experimental drug, which is called AL001, is effective and safe in treating individuals who have a progranulin gene mutation that causes FTD when compared to a placebo. And a placebo is a solution that contains no active AL001 drug. So this drug, AL001, is an antibody, which is a molecule that combines to other molecules or receptors. It attaches to a receptor called sortilin, and it blocks the destruction of the progranulin protein, leading to higher levels of progranulin in the body. And as you'll remember from the previous slide, we said that progranulin was what the body needed to help with thinking and memory. Okay. So as far as the study, approximately 180 participants will be enrolled at 80 sites. So the reason there's a lot of sites is because we mentioned at the beginning that FTD is really rare. So it's hard to find people who have FTD, and it's hard to find a progranulin mutation. People who are eligible for the study will have a progranulin gene mutation, or GRN, and have been diagnosed with FTD, or a person can have a progranulin gene mutation, but not be diagnosed with FTD and have an increased level of a biomarker called neurofilament light chain. So it can either be a person who has the progranulin gene mutation and a diagnosis, or a person who has the progranulin gene mutation and has this increased level of a biomarker. And we just got permission to do testing at our site. So people who have FTD, who might be interested in the study, but who don't know whether or not they have the progranulin gene mutation, we can actually do that testing for them. So how the study works, part 1 is a randomized double-blind study. Randomized, you probably heard that before if you've listened to some of these presentations. It just means that the study drug given will be chosen by chance, like flipping a coin. And participants have 3 out of 5 chances to receive AL001, which is a study drug, and 2 out of 5 chances to receive the placebo, which looks like the study drug but contains no active ingredients. The study is double blind, meaning that neither the participants nor the study doctor will know whether or not the participant is receiving the study drug. And that's just the way that we make sure that the study is fair. That way we're not wondering or thinking about who might be getting the study drug and who might not be getting the study drug. We just don't know who's getting the study drug. So the way the study works, participants will be given the study drug every 4 weeks, and the study drug, either the AL001 or the placebo, will be given as a slow infusion through an IV infusion by a qualified staff member, and the infusion takes approximately 60 minutes to complete. So how long does participation last? So there's 2 parts to the study. Part 1 is a double-blind placebo-controlled study treatment. And as we talked about, double-blind means that neither we know or you know whether or not you're getting the study drug. Placebo-controlled means that you will either get the study drug or placebo. It goes for a 96-week study treatment period, and it's to see if the drug is effective and safe. And it's obviously given to participants who carry the progranulin gene mutation that causes FTD. In addition to part 1 of the study, participants could also participate in part 2 of the study, which is called an option open label extension. If the participant completes part 1 of the study and meets the eligibility criteria, then they would be offered the option to participate in part 2. And the exciting part about part 2 is that the participants in part 2 will only receive study treatment with AL001, and no one will receive placebo in that portion of the study. So some of the study procedures that are required to be in the study include physical exams, neurological exams, vital signs, ECGs, MRI scans, optional lumbar puncture, blood draws, and memory testing. So in order to be in the study, participants have to be willing and able to undergo all of those procedures, except for the lumbar puncture, which is optional. And then this is our contact information. If you're interested or know someone who has FTD who might be interested in participating in this study, We'll also have this slide up at the end of the next portion of the talk, so you'll see this information again. So then we're going to talk about another study that I'm working on called Bassinet Signal AD. And this is a study that has another long title, SIM4AD, Blockade Safety and Brain Metabolic Activity in Alzheimer's Disease. This is a multi-center randomized double-blind placebo-controlled safety and biomarker study of pepinemab. I don't gotta read it. Anti-SIM4AD antibody in early AD. So we're going to be talking about this one too. I'll explain to you what SIM4AD is, and pepinemab is the study drug. This one, just like the other one, is a randomized trial, meaning that people who are randomized to it, it's just like flipping a coin whether or not they get the study drug. And it's double blind, meaning that neither we know nor the study participants know whether or not they're receiving the study drug. So AD International estimates worldwide that the number of people living with dementia will increase from 46.8 million to 131.5 million by 2050. And that's from Alzheimer's Disease International 2015. As the most common cause of dementia, Alzheimer's disease accounts for 60 to 80% of dementia cases. AD is a progressive disease involving breakdown or loss of neurological function, causing problems with thinking and daily activity. Scientific research shows that before people with AD have noticeable symptoms, such as problems with memory, there are very early signs of the disease, including activations of cells in the body's defense or immune system, as well as loss of brain cells and tissues. People with AD may not be able to repair or regrow lost brain cells or tissue. Research has also shown that the action of a molecule known as SIM4AD may be responsible for some of these problems. It is possible that using a drug to stop SIM4AD from working, like the drug being used in this research study, could help reduce or prevent these early problems in AD. So the purpose of this study is being done to find out about the safety and tolerability of the study drug pepinemab. This study is also evaluating any changes in cognition and brain metabolism. So we'll talk a little bit about pepinemab. This study is researching the drug called pepinemab as compared to placebo. Again, a placebo or inactive drug looks like the active drug, but it is not. It is only liquid that contains no active drug. Placebo has no effect on a person because it has no active drug in it. The study drug pepinemab is investigational because the United States Food and Drug Administration, known as the FDA, has not approved it for use. So they oversee this research study. And the way this study works is approximately 40 subjects will take part in the study. Subjects will be assigned by chance, so that's what we call randomized, to one of two dose groups, either a 40 milligram kilogram dose group or a placebo group. Each group will include 20 subjects, which means subjects have a 1 in 2 chance of being assigned to either 40 milligram per kilogram pepinemab for treatment or a placebo treatment. And then for this study participation lasts approximately 52 weeks and will include 15 visits to the clinic. So your participation in this study would last about a year. How the study works, this is also an infusion study. So participants would be given the study drug every 4 weeks. The study drug, which is either pepinemab or placebo, will be given as a slow infusion into a vein called an intravenous or an IV infusion by a qualified staff member. And the infusion will take approximately 2 hours. And then these are some of the study procedures. You would be required, if you were participating in the study, to have physical exams, neurological exams, vital signs, ECG, MRI scans, lumbar punctures, FDG PET scans, blood draws, and memory testing. So those are all of the measures that are part of the study and that are required as part of study participation in this study. So as far as eligibility for this study, these are some of the main eligibility criteria. Each subject is thoroughly reviewed to evaluate eligibility for this study. But in order to be in this study, you would have to be between the ages of 55 to 85, have a reliable study partner, a spouse, a child, someone who knows you very well and spends time with you every week, a diagnosis of mild probable Alzheimer's disease. So we're wanting Alzheimer's disease in what is considered the early or mild stages for this study. You must meet the memory testing requirements at screening to make sure that you're eligible for the study. You have to be in reasonably good health over the last 6 months, weigh less than 275 pounds, and be willing and able to undergo a PET scan, an MRI scan, and lumbar punctures. And again, these are the main eligibility criteria. Each study has its own set of criteria that involves a lot of different health and other types of criteria. And we would thoroughly pre-screen you before having you try to participate in the study to make sure that you meet all of those eligibility criteria up front that we can screen for up front. And then here's our contact information again, if you're interested in either of the studies, if you know someone or if either of the studies look like something that you would be interested in doing.
Excuse me. Thank you, Annette, for that presentation and sharing some of the terminology. Oftentimes we hear those terms and we don't always have that explicit definition of what they are. So thank you for taking the time to share those as well. We've got a couple of questions in here. Marge had asked who's eligible for the second study, but then you pulled up that slide and talked about that. She also asked about lumbar punctures and aren't those dangerous? So I don't know if you want to speak a moment about lumbar punctures. I did put a video link in the chat about lumbar punctures that one of the universities produced. So if you have time, feel free to watch that as well. But Annette, do you want to take that question?
Sure, I'd be happy to speak on lumbar punctures. I will say I'll take the liberty of speaking on behalf of Dr. Burns on this topic. He has said that lumbar punctures, he considers them no more dangerous than a blood draw. And Dr. Burns is the one who would be performing the lumbar puncture. So the lumbar puncture, we don't consider to be a dangerous procedure when we do it. It is what in the old days was called a spinal tap. And just to I can even tell you how we do it here, if you're interested in that. Is that something you want me to share, Tina, how we do the lumbar puncture?
I think that would be really helpful. Absolutely.
Okay.
Because I think lumbar puncture, does not sound like an inviting procedure at all. So I think having a little bit of information about it would be very helpful.
So the way the lumbar puncture is performed is you're basically just leaning over a table, and you have your lower back cleaned with an antiseptic soap, and then you're have an injection of lidocaine in your back to numb your back. And then after that, a needle is inserted in your back between the vertebrae. It's down on the lower part of your spine, so it's below the nerve branch, so it's not going to hit any nerves in your back. It's on the lower part of your spine, and you'll feel pressure, but you won't feel pain typically. And at that point, we take out the spinal fluid, and the spinal fluid is what we use to check and see if it has biomarkers for AD in it. And then usually we ask you to relax, drink a lot of water, not exercise or do anything strenuous for a day. But we do consider it a typically safe procedure. there's always a chance of a headache, a lumbar puncture headache, and that can happen in some people. That depends on if there's any issue whenever the procedure is being done. Dr. Burns hasn't had anyone who's had any of those lumbar puncture headaches, so all of his have gone very well, and we haven't had that as a risk with those headaches. So.
Great, thank you. And Joe had asked what data is the lumbar puncture intended to collect, and so you talked briefly about that with the biomarkers. And then he was also wondering why it's optional in one study, but a requirement in another study.
Oh, that's a really good question. So sometimes study sponsors just want the extra information if they can get it, and that's why it's optional in the first one. In the second one, it's required because they're actually looking at the biomarkers in the lumbar puncture spinal fluid. They're looking at that to determine eligibility for the study. So you have to have a certain level of biomarkers in that spinal fluid to be eligible for that second study. And we've enrolled 2 people so far at our site. We're supposed to enroll 5. We've enrolled 2, and both of them had the lumbar puncture, and both of them had enough of the biomarkers in their spinal fluid that they were able to go ahead and enroll into the study.
Great. All right, does anyone have any other questions for Annette?
So I have a question on that. So with the, now that we're able to do those biomarkers at our site, are people who maybe have a family history of FTD but don't know if they carry those biomarkers, are they eligible to possibly have that checked through us?
You mean for the first study?
Yes, for the first study.
Okay, so someone who has a history of FTD, who has a family history, yes, they could be tested to see if they have that marker. So they could be, so someone who has FTD family history, but doesn't know if they have that marker, we could actually test them to see if they have that marker.
Okay.
And we've got another question along similar lines. So biomarkers are indicators of possible dementia?
Oh, that's a really
Wanting
good
to know
question.
if they are in fact indicators.
They can be indicators of dementia, yes. So for instance, I know one of the most common biomarkers, and this is a biomarker that's actually looked at in this study, in the Signal AD study, is APOE4, which is a biomarker that is found in people with Alzheimer's disease. So APOE4, if you do have that biomarker, you are at a higher risk to have Alzheimer's disease. So that would be a biomarker that could say, yes, you're at risk to have Alzheimer's disease. Now, the caveat with that biomarker is that about half of the people who have Alzheimer's disease have that marker, and half of the people who have Alzheimer's disease don't have that marker. So it's not always, a biomarker doesn't always guarantee that you're going to have a disease. You could still have the biomarker and not have the disease, or you could have the disease without having a specific biomarker.
Thank you. And I've got a question about disclosure. So do you disclose after the testing is done if they have these biomarkers? And then also, can people test without going forward in the study? So just have the biomarker done and not go forward.
So so they're kind of different for each study. Are they talking about the FTD study or the Alzheimer's disease study?
Let's answer it for both. They don't specify, okay. So we'll answer it for both.
For the FTD study, for the progranulin mutation, you have to have that mutation in order to be in the study. So you would know that you had that mutation. That's something that is shared with you. In the Signal AD study, one of the things that they test for is APOE4, but they do not share that with you. They keep that as their study sponsor information. However, you would know that you had the biomarkers in the CSF or the spinal fluid because you would be able to move ahead with the study. So that would say, yes, I have enough of the biomarker in my spinal fluid to move ahead and be in the study.
And then also you could have the lumbar puncture and not have enough and not participate in the rest of the study too.
Correct. You could have the you could have the lumbar puncture and they say that you don't have enough to be in the study.
Perfect. All right, other questions? All right. Well, Annette, as always, thank you for coming on and sharing information with us about the studies. Amy, was there another question? Were you going to say something?
Nope. I think
Okay.
that answered my question.
Okay, I thought I heard you. So thank you very much, Annette. We really appreciate your time and sharing all of this great information with us. I do want to remind everyone that for the Thanksgiving holiday next week, we will not have a weekly webinar. So I hope you're able to spend time with your family and friends next week. And just a friendly reminder that we will have the recording up on our website, available within 24 hours. And you can find out about our next presentation in December from the My Alliance weekly newsletter on Monday. If you have any questions, feel free to email us at myalliance@kumc.edu. So thank you again, Annette, and everyone have a wonderful next 2 weeks.
Thanks, Tina.
Bye-bye.